Hi everyone, I'm really excited that so many of you have recently joined the group, so welcome. So I thought it might be time to do my favourite topic, which is retinoids. It's something I'm particularly passionate about, so I thought now might be the time to do that topic. So I hope you enjoy. So just to give you a little bit of a background about retinoids, I hope I don't bore you with this, but it was originally used as an acne treatment in the 1960s, and it was through that it was discovered that it actually had this remarkable anti-aging effect. So they were noticing that actually the epidermis, so the one of the layers of the skin, was becoming thicker, and therefore the skin was looking healthier, and they were actually noticing a reduction in pigmentation as well. So it took till about the 1980s for it to really start to be used as a mainstream anti-aging product, and to date, it probably has the most clinical evidence backing it. And in my opinion, no other topical compound has rivaled the anti-aging effects of retinoids, which is why I'm particularly passionate about them. Okay, so I think there's a lot of confusion surrounding retinoids because there's lots of different types. There are 5 main types of retinoids. Some stronger than the ones I've got here and some weaker. However, these 2 main branches, so the retinols and the retinoic acids, are commonly found in skincare items. So I thought that it would be best to describe those for now. The retinols, they often come in a 0.5 and a 1%, but this can be very confusing because retinols actually exist in a non-active form. So the skin has to convert them into an active form. And therefore, that 0.5 or 1% actually means that it's not as strong as the retinoic acid family. So somebody might come into the clinic and say, oh, why would you suggest starting with a 0.025% or a 0.5% when I've been using a 1%? And that's simply because you cannot compare these two retinoids. And these retinoic acids are much, much stronger. And that also is the same principle when you're picking your skincare products. So don't be misled by looking at the percentage and assuming that you are buying a stronger product when in fact actually you may not be, and that's a little bit of a tricky idea to get your head around, and it does differ from product to product, but at least if you know that, you can do a little bit more research or post the product on the group and I can give you a little bit more help with that. So the retinoic acids are in their active form, and you've got the sort of Roaccutane here as one option, and we might know that as the acne treatment. So it's a pill that you would take for 6 or 9 months to treat acne. And then you've got the tretinoin, which is a topical cream. It can be used to treat acne, and it comes in these sort of 3 main percentages, but it's also good for anti-aging and particularly for pigmentation, for treating pigmentation. Moving on, in general, what do retinoids do? So we've briefly touched on the acne sort of aspect. The way that the retinoids work, they actually reduce the oil or sebum production of the skin, and that's what blocks the pores and causes that real sort of blocked acne, congested appearance. And it also, so not only does it stop the oil production, it actually stops blockages in the pores as well. And in doing so, it reduces the size of the pores, which is actually an effect that lots of people love. In terms of the anti-aging effect, so it increases the fibroblast production, and that's a particular cell in the skin that is responsible for producing collagen. So you're going to get more collagen, and the retinoids actually stop the breakdown of the collagen as well. Lots of people complain that retinoids make their skin dry, and that is true in the short term, but in the long term, it increases the glycosaminoglycans concentration in the skin, and therefore it actually hydrates the skin. So long term, you're going to get a really nice hydrating, smoothing effect to the skin. And as we've talked about as well, the retinoids reduce pigmentation, particularly when combined with other products like hydroquinone. And together they have a really powerful effect against pigmentation. Just a quick before and after to lighten the mood. So this particular patient had a 0.5% retinol. So if you remember from that earlier slide, that's the less strong formulation, and actually the 0.5% is a really, really low concentration. But even with that, you can start to see the effects, more radiance. I don't know whether you can see there, but actually on the forehead area, she's got less wrinkles. Would we want her to have a higher percentage? Yes, we would. But we're going to see even more effect once we see her kind of graduating onto a higher percentage. But this gives you a little bit of an idea. And anybody that wants to revitalize the skin, reduce that kind of dull appearance to the skin and really get that glow, retinol's the option. Important things to note, they aren't for everybody. Pregnant ladies, some medical contraindications, some people with super sensitive skin, although as we've demonstrated, you can really adjust the concentration of the retinol depending on the product, depending on the concentration, depending on the formulation. The most important thing from this whole presentation is if you're going to use a retinol, you must commit to sunscreen. And in my opinion, a factor 50 is the minimum. They will make your skin more sensitive to the sun. It's good practice anyway to be wearing a sunscreen every day, but that is really a take-home message. The other take-home message is it does require commitment. So the clinical studies have shown us that although you do see early benefits, like we saw in that picture where we looked at the effects after 4 weeks, the clinical studies have shown us that the improvements to the skin can take up to 10 months. So at 10 months, things tend to plateau and we move on to, more of a maintenance approach. But up to 10 months, we're seeing improvements week by week. So you have to commit to using these type of strong products. And you have to get over that barrier where you're going to get that dryness, you're going to get that redness, you're going to get that peely, that peely skin. And you have to break through that to be able to see all the benefits. And you can expect those initial side effects to last anywhere from 3 to 6 weeks, depending on your skin. And the other thing is that you can't shy away from those effects. So some people come in and say, oh, well, I've been just using my retinol for once a week. That doesn't work because retinol, the types of retinols that we've been talking about will stay on the skin for about 72 hours. So unless you are doing a minimum of once every 3 days, you will never be able to build up these positive effects in the skin. You're just not using it frequently enough. So yes, you're not getting the side effects, but you're not getting the benefits either. And an important thing to note is some of these retinols are prescription only. In general, a 0.5% retinol and a 1% retinol are available over the counter. The retinoic acids, which if we remember on our chart with the stronger formulation, are prescription strength. And they can be prescribed by medical practitioners. I do prescribe them in my clinic, dermatologists, and often they are available on the insurance. Some formulations are not available on the insurance, which brings me to an important point that these type of products vary in quality. They vary in quality with the over-the-counter products and they vary in quality with the prescription products. Some products will be more expensive than others. Some will be better quality than others. Not to say that you can't get reasonably priced retinols on prescription, but you just have to be careful. And some clients will come in and ask me why I've prescribed a particular product for them and they've paid $100 for it or £100 for it, when somebody else, one of their friends, has got a product and they've paid $20 for it. And I say it's like anything. Price doesn't necessarily determine quality, but some of the time you get what you pay for, and it's like a particular face wash or, you know, another particular skincare product. You can buy a face wash for $5 or £5. You can buy other face washes for £80 or $80, and there will be differences in those. I am a firm believer that spending more money doesn't necessarily get you those key ingredients and good quality products, but it will play a role in that, and it's something to remember. I'm nearly finished. One really interesting fact is actually that retinoids can be ingested in the diet, specific fish and vegetables, and it's basically vitamin A. And actually, Bottle Science, who are the company that make the Skin Aid collagen drink, have actually introduced a brand new product within their range called the Derma Defense, and it's a liquid retinol. So for those people who can't tolerate the retinols very easily, this is a potential alternative. They do have a lot of, you know, clinical evidence and studies that are available, and I can send those to you if anybody's interested. Great, so that brings me to the end of the presentation. If you've got specific questions related to the products that you're using, this is only the tip of the iceberg on what I deem to be a very interesting topic. So please fire away on specific questions and product related questions, and I will do my best to answer them, and I hope you found that interesting and informative.